The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
And you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, South Florida, and welcome back to another episode of You and Your Doctor by All County Care. All County Care is a Medicare certified home health agency. We service Palm Beach, Broward, and Miami-Dade counties. We send nurses and therapists into you or your loved ones' homes to provide the best care for them. And we will get right into this interview. Tonight, we have a wonderful and special guest, Dr. Jonathan Levy from the Orthopedic Levy Shoulder and Elbow Center at the Paley Institute. The Paley Institute being a world-class institute of surgeons, and he is located in Boca Raton, Florida. I want to welcome you, Dr. Jonathan Levy. Welcome to our show.
Thank you so much, John.
Yes, Dr. Levy's office is located at 9960 Central Park Boulevard North, Suite 150, A as in Apple, Boca Raton 33428. It's on the campus of West Boca Medical Center, and you can reach them at 561-922-9112. That is 561-922-9112. Also, you can reach them through their interactive website, which is a great portal for even scheduling appointments. And that is www.paleyinstitute.org. That is, once again, www.paleyinstitute.org. On this website, you will see a range of information about the wonderful doctors, including Dr. Jonathan Levy, a board-certified orthopedic surgeon specializing in shoulder and elbow surgeries. Dr. Levy is also on staff at West Boca Medical Center, and he has been involved in quite a few peer-reviewed publications over the years. Dr. Levy, would you like to touch upon a little bit of the peer-reviewed writings and publications you've done?
Yeah, sure. So research has always been a really important part of my practice. The concept of evidence-based decision-making, right? Making sure that we don't just have a hunch of what we're going to do for our patients. We actually have the evidence and the literature to support it. So I've been involved in clinical research really since I finished residency back in 2005. 2010, as a physician at Holy Cross Hospital, I started the Holy Cross Orthopedic Research Department. Wonderful. And really kind of jump-started a career in academic research. I mean, it's not uncommon for me to be asked by our Shoulder and Elbow Society to give the talk on how to do research in a private practice setting. And I've been fortunate to work with a phenomenal team, having research fellows on an annual basis that come and spend a year with us to learn how to do research and really get involved in what research is all about, and really trying to answer questions that don't have answers within our realm of clinical medicine. And so, yeah, I've been fortunate probably over the years to publish 150, close to 150 different articles and chapters and things like that. And I'm on the lecture circuit teaching docs all around the world how to do shoulder and elbow surgery, and presenting research all around the world as well.
That's great.
Yeah,
That is great. Where do you find the time? And we were talking before the show. You were raised here in South Florida, which I think is absolutely fabulous. We're so lucky to have you here. And you've actually made your way up now into Palm Beach County, starting down in Miami-Dade County. That's great. And you must have seen quite a transition as well, with not only with patients, but the demographics and the vast growth.
Oh, absolutely. I mean, I grew up in Aventura, and Aventura Mall was a lake.
Oh,
right?
wow.
Those were back in the days. But I remember riding my bike to Highland Oaks Middle School before it became, whatever. It kind of changed its name when I was in the middle of it. And then go to North Miami Beach Senior High, and then eventually to college at Northwestern. That took me out. But I've been in Florida pretty much almost all of my entire life, with the exception of undergrad and medical school.
Okay.
Because as soon as I finished undergrad and medical school at Northwestern, came back to the University of Miami for my residency. I did a fellowship in Tampa, and then came back. And my first job was at Holy Cross Hospital in Fort Lauderdale.
Wonderful.
Now I'm inching my way back up.
Yeah,
a little bit.
that's absolutely fascinating, and I'm glad you touched upon that. Dr. Levy is Northwestern University from the great city of Chicago, the Windy City, and then he made his way back down here, and like he had mentioned, he did his training residency at Jackson Memorial. So he's got deep roots here, folks, and he's a wonderful, wonderful board-certified surgeon, and we're just glad to have him here. So we will get right into the interview with some questions in regards to exactly what you do with your practice. What are some of the signs that a shoulder surgery might be serious, and when should you seek, somebody like yourself, a professional's advice from, an orthopedic surgeon when you have, something that's ailing you?
Yes, I think, there's triaging that happens all the time whenever we have an injury, right? We sort of have a moment like, is this something serious? Do I need to get this taken care of now, or can it wait? And I'd say when in the realm of shoulder and elbow surgery, the things that really don't want to wait are, well, you might have dislocated a joint, right? That has to go to the hospital, and someone's got to pop the joint back in. So the shoulder and elbow can dislocate. More commonly, though, we'll see injuries that may not be from any major event, but let's say you lift something heavy and you tear the most commonly torn tendon in the shoulder, which is a rotator cuff tendon, right? And you know that because for the next couple of days you can't lift your arm. And then all of a sudden it starts to get better. And while you might be able to recover the ability to lift your arm within a few weeks, you still may have a big rotator cuff there present. So I'd say that's, if I picked one thing to be watching out for, it's the sign you have an injury and then you can't lift the arm up. That's a telltale sign. Get an x-ray, get evaluated. That might be something a little bit more serious.
Great advice. Thank you for that. Is there a shoulder injury that's more common, and you covered that with the rotator cuff, but are there any others that you say that you've seen over the years in your experience?
Yeah, I'd say in my practice has really developed into a niche that's heavily, I'd say the most common two things that I see in the shoulder are rotator cuff diseases. And I say diseases because sometimes they are a chronic disease. Sometimes they tear all at once, but more commonly they're more of a wear and tear over time disease, and they tear over time. And then osteoarthritis, shoulder arthritis. Those are the two most common things that I see in my practice. But there are absolutely other injuries and things that I've seen. For example, a distal biceps tear. That's what we call an elbow biceps tear, right? Sounds
painful.
Yeah, and it's pretty consistent, right? You have a 40 or 50-year-old guy who's carrying, doing a favor to a neighbor, and he's carrying a television in with him.
Wow.
And then the neighbor across from him, who's holding that other side, just doesn't have the strength to hold it, and all of a sudden you're holding all of that. boom, you'll feel a pop and you see a change.
Wow.
So that's a classic description of a biceps tear. And those actually you got to get to pretty quickly. You have about a 2 to 3 week window when it changes the way we approach it.
Okay.
And so anytime delay in time starts to change the way you approach a problem, that
Yes.
means you want to get it evaluated and treated soon. So that's another one. But that's at the elbow side. That's not on the shoulder side.
Okay.
But that's more on the elbow side.
Okay. Well, you cover them both. You cover elbows and shoulders, and we're very lucky to have Dr. Levy here as part of the wonderful Paley Institute. Can you explain some of the more complex surgeries that you might perform?
I'd say probably the most common operation that I perform is a shoulder replacement. And that might seem complicated. I guess in my world, when it's the most common thing I do, it's less complicated in my mind. But for sure, people have talked about hip and knee replacements for years.
Sure.
Pretty good track record doing hip and knee replacements. And I'd say now in 2023, we can say the same for shoulder replacements. There are two different types of shoulder replacements. There is a typical shoulder replacement where you replace what we call an anatomic shoulder replacement.
Okay.
That's when we replace, let's say, the ball with a ball and the socket with a socket. It matches the anatomy, and that's why we call it an anatomic shoulder replacement. But something that has developed really over the last probably 15 years is something called the reverse shoulder replacement. So we actually place the ball and socket in different orientations. The socket becomes a ball, and the old ball becomes a socket.
Interesting.
Change the articulation. And it's actually, so when I did my fellowship, I trained with, I finished my residency, 5-year residency. I go to Tampa for a 1-year mentorship type fellowship. Okay. And I trained with Mark Frankel, who is sort of like the American godfather of the inventor of the reverse shoulder replacement.
Oh, wow.
Right? So he, together with him, we started to publish on his early results. And then, since that, I've continued. He's one of my closest colleagues, closest mentors, closest friends. And we've been a part of a series of design innovations that have happened from that original reverse shoulder replacement that probably got released into the market, I want to say, in 2004.
Okay.
And so it's revolutionized the way we approach shoulder surgery. Now, probably 70% of all shoulder replacements are actually reverse shoulder replacements.
Wow.
So it's kind of really changed the way we approach shoulder surgery in general when it comes to these more complicated reconstructive efforts. Because patients who need shoulder replacements usually are patients historically who've really just suffered from bad arthritis.
Okay.
And arthritis can affect you in dramatic ways. You can't lift your arm up. You can't move your arm. Even at rest, you can have some rest pain.
Yeah.
And that's been the classic reason. But now, with a reverse shoulder replacement, we're able to manage problems that relate to the chronic disease of rotator cuff disease.
Okay.
So in addition to osteoarthritis, in addition to typical arthritis, now we have another sort of complicated problem. Didn't have great solutions before, and now introduced the reverse shoulder replacement. And now we have some, a really phenomenal, reliable solution that has, now we can say, a really strong track record too.
It sounds fascinating and very interesting. And like Dr. Jonathan Levy here stated, you want to get evaluated early. There are a lot of more common things like the torn rotator cuff, but it's always good to know the symptoms. Once you see a change and there's continual pain, go and see a professional like Dr. Jonathan Levy, and he'll evaluate you and let you know what your options are. Excellent. Very interesting. What exactly does cause the rotator cuff injury?
80% of the time, rotator cuff is sort of a wear and tear event.
Okay.
So it doesn't really, we often get events where people say, I was fine until I went and lifted something out of the cupboard. A gallon of milk got me. Okay. Well, that's really like that analogy of the straw that breaks the camel's back. There's been degeneration that's been brewing there for quite some time, and then it fails. And that's the most common form of a rotator cuff tear, is one that just really presents with pain. And then some patients will recognize that they're having weakness, but not always.
Okay.
Then the other 20% happen from an event, a trauma, a fall, an accident, when you went from having normal function to, okay, I can't lift my arm.
Yeah.
And those are kind of handled differently. You can imagine a chronic degeneration of a tear is one where you try to beat with things like physical therapy, anti-inflammatory medications to relieve pain and allow you to facilitate strength recovery.
Yes.
In contrast to patients who tear their rotator cuffs from an injury, we almost handle that much like a fracture might happen. If you break something and it's separated, you have to bring it back together sometimes with surgery. And that's what we do with a rotator cuff repair. And that's a surgery to actually repair a torn tendon. That we more commonly do it in this acute type of traumatic tear where you have an injury. But even some of the degenerated ones, they still can hurt and cause problems for patients, and we fix them if we have to.
Sure, absolutely fascinating, and thank you for that in-depth explanation. As you were also touching upon fracture care, starting with the proximal humerus, and please correct me if I'm wrong.
Sure.
Fracture. Can you talk about this injury, because this is a question coming in from somebody specifically, so they might want to know. I think it was a sports injury.
Yeah, so we have the bone here. It's called the humerus, which
Yes.
it's not for any funny reason, but the top portion of that bone we call the proximal humerus, and that's the shoulder, right?
Yes.
So it's the ball portion of the shoulder is the proximal portion of the humerus. It's the upper part of the humerus bone, and when you fall, it's one of the most common fractures that we see when people have slips and falls, right? Especially as your bone quality starts to deteriorate as you get older. Let's say you have osteoporosis, where your bone density is affected, or osteopenia, where it's starting to become affected. Then you're more at risk to having an injury when you fall. So one of the more common fractures that I see are not from major accidents, on 95. They're more from the slips and falls that we see at home as patients' bone quality deteriorates. And then, sky is the limit in terms of the presentations. And is it in 3 or 4 different parts, or is it separated or shifted? And all of those go into the decision making of what to do. Yeah. And the treatment is everything from keeping the arm in a sling and starting a rehabilitation with physical therapy, to trying to fix the fracture, meaning piece the pieces together, secure them with a plate and screws to hold them in place, with a surgery that does that. To, I'd say the worst case scenario is the bones are really not reconstructible anymore, and we do a shoulder replacement. And the shoulder replacement that we do these days for that is the reverse shoulder replacement.
Oh, okay.
So that's another sort of area where it really changed the game at doing shoulder reconstruction. When we have patients who've really shattered their shoulder bone or their proximal humerus,
Very nice.
we do a reverse shoulder replacement routinely now for that.
Oh, that's great. And such a wonderful explanation from Dr. Jonathan Levy. That was very interesting. And, while we're on the topic of patients, what is the age range of patients that you see typically?
Yeah, I'd say in South Florida, I'd say the age generally is between 50 and 80.
Okay.
But let's say the oldest patient I've ever had to do a shoulder replacement on was 96. I've had a couple people at that level. So there are some amazing 96-year-olds. I had one patient who wanted to continue to do Tai Chi at 96 years old, and I had all the interest in trying to, grant her wish. But I also take care of the younger patient population as well. We don't see the really pediatric population too much, so it's really more sort of the late teens and into into the early adulthood that's the majority of who we see.
Got it. So, folks, you heard that. Dr. Levy sees a number of patients of all ages. He will see, teenagers up through adult and seniors, as well as he saw a patient at 96 years old. That's very impressive. And it's very impressive that, these folks are continuing to seek out an expert like yourself to have this done. And folks, to know that there are options. We really appreciate Dr. Levy's services, and it's great to know that a great organization like the Paley Orthopedic Institute is there for them. So moving on, earlier we were talking about a bicep tear, and you had a good description about how somebody was moving maybe a TV. And another person was helping them, and then the weight got shifted, and one didn't help as much as the other, and they suffered a bicep tear. So how would you treat that kind of injury?
So I think when you tear your biceps, it's really very important to know in which direction it came from. Did it tear at the shoulder or did it tear at the elbow?
Okay.
Because the ones that tear actually in the shoulder, it's most commonly called the long head of the biceps. Okay. It's very common to tear, to be honest. And it's really, we often call that tendon the appendix of the shoulder. Meaning,
Okay.
we know it causes pain. Sometimes when they finally get rid of it, it gets better. And as shoulder surgeons, we often like to give analogies of who had biceps tears, and we often use John Elway as an example of someone who tore and ruptured their biceps and still was able to win a Super Bowl in their throwing arm with a torn biceps. But that's a biceps tear that happened up from the shoulder.
Wow. That's
Down at the elbow is a little bit different because in the elbow, the biceps, which is technically two tendons kind of coming into one, there's only one insertion. And so if you rupture that, all of a sudden you do lose function. You lose the strength of rotating, what we call supination.
Yeah.
And you can lose some of what we call elbow flexion, which is bending of the elbow, the strength there.
Yeah.
And so we fix those with a surgery. A technology that has a little miniature button. It almost looks like a cufflink that we use to actually secure the tendon down to the bone. But that's essentially what we do. We find the tendon edge, bring it back to where it came from, and repair it utilizing some modern fixation techniques. And one of the more common ones we use is something called an endo button, which really looks like a cufflink.
Okay. It's just so fascinating, all the intricacies that go on. I mean, it's an art. It really is an art. And, over the years, I've learned a lot more about medicine and from surgeons like yourself. And, I've got more profound respect for you and for your fellows because, they're here for us. And when situations arise and you need, to get your body repaired, it's reassuring to know that an expert, a board certified expert with all these years of experience like Dr. Jonathan Levy is here for us here down in South Florida. And, fascinating, interesting story about that John Elway. That is very interesting. And to know he went on and won a Super Bowl is also very impressive. So that's interesting. So moving on, so how would you, we talk about a lot of the surgical procedures, but how would you repair a shoulder per se, besides the traditional rehab, for a non-surgical, minimally invasive or type care for it?
Yeah, so I always joke with my team. So my team typically, I have two physician assistants that work with me. Sarah Blum, who's been with me for 15 years, Katrina York, that's been with me for a few years, and we always kind of joke, through the day because I spend about half of my time with patients convincing them that they don't need an operation, and the other half kind of affirming that their suspicions were true or that what they've been told by other surgeons is correct and we need to move forward. And so in that group of patients who say, okay, I'm really, I'm telling them they don't need an operation, those are either situations where they've even though they have a tear or an injury, they've adapted so remarkably well to it that the body has really just gone through appropriate adaptations, and maybe through things like anti-inflammatory medications or physical therapy, they're able to sort of get through that full compensatory rebound and avoid an operation altogether. And then there are some that, my opinion is just different, right? I look at, let's say, a rotator cuff tear. Sometimes you can have what we call a partial tear of the rotator cuff. People see a tear and they immediately think, oh, the tendon's completely ripped off the bone. But a partial tear actually means it's only part of it is ripped off. And those actually can respond quite well to a non-surgical approach. And so we use a variety of different things, modalities, to approach non-surgical management. I mean, the more common things are common. Anti-inflammatory medications, those are commonly used. Physical therapy, use it routinely, whether it's done with a therapist, a good therapist, or even sometimes a solid home exercise program can help patients do it. And then there's a variety of sort of the newer types of injectables, things like platelet-rich plasma and stem cell injections. And there's a whole biologics area that is expanding, and we're learning a lot more. And, we don't have solid evidence on a lot of that stuff, but we have a lot of anecdotal evidence, which is really you and me chatting and saying you had a good experience and me wanting to have that same experience,
But I can imagine, as you've seen, everybody's bodies react differently. And like you said, every injury or, type of therapy may react differently on different people, with the different ages, I'm sure.
Yeah.
But I know some of our listening audience would love to hear about, do you have any advice for, besides what we read in, our science and health books, over the years of keeping your bones as healthy as possible? Is there, besides the calcium, the magnesium that we hear about? And
I mean, I do believe, when it comes to bone health, bones respond to stress.
Okay.
There is a principle, it's called Wolff's Law. Wolff's Law states that bone will always react to the stress that it places upon it. So the more stress you have across a bone, the more you're going to build up bone.
Okay.
So if you sit on the couch and watch TV all day, your bones aren't getting loaded. You need to get out. You need to exercise. You need to stay active. And probably that's the most important, in addition to calcium and vitamin D if you have issues with that. But staying active, no question about it, from a bone health standpoint, makes a huge difference.
Oh, that's very, very nice. And as we're wrapping up here with Dr. Jonathan Levy, an orthopedic surgeon specializing in shoulder and elbow surgeries, he is at the Levy Shoulder and Elbow Center at the Paley Institute, located on the campus of West Boca Medical Center, which is 9960 Central Park Boulevard North, Suite 150, A as in Apple, Boca Raton 33428. The phone number to reach him or his wonderful, helpful staff is 561-922-9112. That is, again, 561-922-9112. And I do urge you to check out the informational, including Dr. Levy's bio, on www.paleyinstitute.org. That's .org. So that is PALEY institute.org. It has a wonderful portal where you can even place your information in there, leave a comment, and go about the scheduling process. Dr. Levy's office accepts most major healthcare plans, but do feel free to call the office anytime to check on that or put the information in the portal, and a representative will get back to you very shortly. I want to thank you again, Dr. Jonathan Levy. This has been an absolute pleasure. Is there anything else you'd like to just add to our listening and viewing audience to let them know?
No, thanks so much for inviting me. This is always fun to have these types of conversations. I always sort of think back at what really makes me who I am professionally, and I really divide my life into 3 different lives within my professional practice. It's obviously what I do day to day, which is taking care of patients, but the research component, and then I do quite a bit of design work. I've been involved in the design of a number of shoulder replacements and shoulder fracture plates and things like that. But at the end of the day, it's all about family. And as soon as I get out of here, I'm